Are you turning 65? I have a checklist of all the things you need to be thinking about before your birthday. Hi, my name is Jo Hutchison. I'm an independent Medicare advisor with Founders Life and Health, and today we are talking about all the things you need to be thinking about before you turn 65. 6 to 9 months out from your 65th birthday, we should be starting to think about Medicare and how you're going to take your Medicare. So first things first, get in touch with your doctor, your current primary care doctor, and find out if they accept Medicare. Next item on our list, and this is a big one, is deciding if you're going to continue to work or if you are going to retire. If you're going to continue to work and your employer has group coverage, then we can take that into account as far as whether or not you're going to take Part B of Medicare. I'm going to put a link above right here to a video that I made about taking Medicare when you are continuing to work. Next on the list is deciding if you're going to be taking Social Security. If you are going to be taking Social Security at 65 or 66, then that's going to affect your Medicare differently than if you hold off and take it when you're 70. Take a look at your current health insurance. If you have a group plan right now, sit down with your Medicare advisor and look at the things that are on that plan that you like about that plan, and let's talk about the things that are on that plan that you don't like about that plan. You can use that information moving forward as you're deciding if you're going to go with a Medicare supplement or if you're going to go with an Advantage plan. Next is making changes to your HSA. If you have a health savings account, you will no longer be able to contribute to that account. So here in this 6 to 9 month before your birthday period, you may want to, depending on how many funds are in your health savings account, stop contributing. You can still use those funds after you retire, but you won't be able to contribute anymore. So take a look at your HSA and make sure that all of that is lined up and ready for your 65th birthday. Next, you'll want to take some time and just learn the basics of Medicare. Learn what each of the parts are. Learn what a Medicare supplement is versus Medicare Advantage plan so that you can start thinking about how you want to move forward with your Medicare. Okay, let's fast forward to about 4 months out. So now it's about 4 months before your 65th birthday. What should we be thinking about? Now is the time when you really should start doing some comparison shopping on Medicare supplements versus Medicare Advantage plans. And the things you should be looking at are what are the monthly premiums, what are the deductibles, what are the co-pays, and what are the co-insurance. As you're looking at all of these plans, there are several questions that you'll need to ask to know about each of the plans individually. One of the most important questions is, do I have to choose a provider from a network? So going back to that question from before, if you have a primary care doctor, are you going to be able to use that doctor, or are you going to have to pick a doctor out of a different network? Next, can I travel and use my plan? Super important. If you are the kind of person that wants to travel all over the country, travel all over the world, then your Medicare plan should be looking at a supplement versus an Advantage plan. So it's important to ask those questions too. Does my current doctor accept coverage? Very important to ask. Do I need a referral if I want to see a specialist? What will the prescription cost be? You should sit down with a Medicare advisor, look at the prescriptions that you're currently on, and figure out what those costs are going to be if you have a prescription drug plan or if you have a Medicare Advantage plan. Check and make sure that your drugs are on the company's drug list. Check and make sure that you can use your pharmacy. Find out if you can get your drugs mailed to you. If you're looking at a supplement, you'll want to ask how often the rates increase on a plan. So it may start off at a certain premium per month, but that's going to go up, and you want to know how often that company changes their premiums. Okay, now we're about 3 months before your 65th birthday. What should you be doing now? You should be enrolling in Medicare. You've done all of your planning, you've asked all of your questions. Now you should be at a point where you understand your options well enough to be able to make some decisions and start getting enrolled. Once you've enrolled in your plan, find out if you need prescription drug coverage, if it's not already included. And you'll want to look at dental, vision, and hearing as well, and find out if those things are already included in what you have enrolled in, or if you need to look at something outside of your plan. Once you've enrolled and you've got everything set, you're ready to turn 65, there are a couple more things you need to do after you've enrolled in everything. Make sure that you get your red, white, and blue card in the mail. That will come from Medicare. It usually comes in kind of a not very obvious envelope, so I've had lots of clients that accidentally throw that away. So keep an eye out for that. You will also get insurance cards from the carrier, whatever carrier you choose. So you want to keep an eye out for those two things. And last but not least, start doing some research on all the places that you're about to get discounts on. I hope this was helpful. Please subscribe down below and hit the bell for notifications. I make new videos every week.